If we put it in the perspective, for example, shopping. In the beginning, when all of the COVID-19 began here in the Bahamas, a lot of people were panic buying. So you will see the cognitive aspect where having to be locked down for 5 days, that thought of, I'm not going to have enough food in the house to last for 5 days. So then that thought led to the feeling of being anxious and being fearful and worrying about, am I going to have this? Which leads to the body then having the physiological reaction of the heart rate, feeling alert, feeling the pressure to immediately go out and seek the resources that you are fearful that you lack. And then you have that behavior aspect, which you're actually going into the store and buying more than you actually need because of that fear and that anxiety that is being driven by that thought.
Great. Anxiety overview. Occasional anxiety is an expected part of life. You may feel anxious about when you face with a problem at work, before taking a test, or before even making an important decision. And that's the normal routine of our anxiety. That's what we call just the regular normal. It is not one where it becomes long-term. Anxiety disorders involve more than temporary worry or fear. And I know Doc will explain the difference, because a lot of time we like to interchange anxiety with worry and fear, and they are different. For persons with an anxiety disorder, the anxiety does not go away and can get worse over time. And I must say, if it is not treated, and if it's not treated properly. The symptoms can interfere with daily activities, such as job performance, school, work, and relationships. So, you're feeling anxious about, do you love me? Is this relationship gonna last? Are we gonna get a home? How are we gonna raise the kids? Where are we gonna live? And if that becomes overwhelmed over a period of time, then there is cause for concerns. There are several types of anxiety disorders, including generalized anxiety disorder, what we call GAD, panic disorder, and various phobia-related disorder. Go ahead. You want to add?
No.
Okay, good. Let me just let this other person in. You can see as we showcase here, the pyramid here. In the middle there, you see the anxiety, and connected, we will discuss certain phobias, we'll discuss panic disorder, general anxiety disorder, all interrelated to anxiety.
Just to highlight, those are not the only disorders that we have in the DSM-5. Those are just ones that we are highlighting today in this particular series. I just want to really highlight that underneath the anxiety disorders, one of the main common thread that you will see in all of them is the extreme anxiety that is a part of situations or stimuli that heightens a person's experience and causes that anxiety to be more significant than a daily life event.
Okay. People with GAD, or what we call generalized anxiety disorder, display excessive anxiety or worry. And like I stated before, this lasts about at least 6 months. And there are a number of things such as your personal health, your work, everyday routine, life circumstances, and even your social interaction. The fear of anxiety can cause significant problems in areas of your life, such as social interactions. People really can't go there and socialize with their colleagues, their classmates, even their church folks. They have a serious issue or problem dealing with them. Also, you'll find it at work and at school. Some of the symptoms of GAD: feeling restless, wound up on the edge, always irritated, being easily fatigued. And if you find yourself anxious or having anxiety for a length of time, and you go, you know, you didn't even go jogging, you already slept some 8, 9 hours, and you get up and you exhausted and you're fatigued, that can be a symptom. Having difficulty concentrating, mind going blank. You know, you have a project or you have a timetable that you have to meet, and you can't even get the goals in order, or you can't even place the right phrase in this paragraph where that should be. They're the kind of things. Being irritable. And this isn't just, like I would tell my wife, it isn't just, you know, Troy being miserable or irritable, but it's more than just that. Where you can't put your finger on it. Why am I being miserable? Or why am I being irritable? And sometimes it can have biological effect, or biological effect leads to that. And there are some of the signs. Having muscle tension, difficulty controlling feelings of worry, and it becomes really excessive. You know, there's always a what if this happened? What if that happened? What if this happened? With the worry. Then you have sleep problems. And then you have difficulties falling asleep, restlessness, or even sometimes you unsatisfied about sleeping, or you have difficulty actually getting to sleep. Panic disorder. Panic disorder, as you're aware, is a part of anxiety. People with panic disorder have recurrent, unexpected panic attacks. You know, their panic attacks is often sudden, in periods of intense fear. Oh, I wonder if I'm going to lose my job. Oh, I wonder if I'm going to be able to pay BPL. Wonder if I'm, you know, and it goes on, and then you look forward to the next, or you wonder when the next panic attack is going to come. And then on quickly, and you reach peak within minutes, and it happens very, very fast. Attacks can occur unexpectedly, or can be brought on by a trigger, such as a feared object or situation. And you want to share some examples of that, Dr. King?
In relation to
Panic
their
attack?
panic disorder, the panic attack.
Mm-hmm.
I usually tell people panic attacks feel like you're having a heart attack.
Yes.
That is the best way to kind of visualize what it is. A lot of the persons that will experience a panic attack will automatically go maybe call 919, 911, or find themselves in the hospital thinking that they are having a heart attack. And after a medical doctor has assessed the situation, some of them are diagnosed with a panic attack. And they are then referred to a mental health professional like myself. So when we are talking about a panic attack, I always tell people that panic attacks usually gets to its height within about 10 minutes. You might find some persons constantly in their mind doing the worst case scenario thinking, and usually work themselves up. And then one aspect that we talk about with panic attacks is worrying that you're going to have another one. So that on top of it adds to the level of the panic of worrying about it. And I think in the next couple slides, you'll see a panic cycle that begins. And a panic attack can be triggered by anything. It could be triggered by any kind of trigger for that individual. So in helping someone with a panic attack or a panic disorder is assessing the situation and trying to figure out what it may be causing, the underlying causes of the panic attack after they have been cleared medically for reasons for this particular attack.
An experience that I would have had with panic attack, I remember during my years on the Royal Bahamas Defense Force, I was currently then enrolled in College of the Bahamas in the Law and Criminal Justice program. And I had applied for study leave. And one day I went to work, and because the Commodore denied my full-time study leave, I had a serious panic attack. I didn't know it was a panic attack then. I thought I was having a heart attack because I was having shortness of breath, heart palpitations and such. And I could hardly move. And they had to carry me over to sick bay. And they called the ambulance for me. Actually, I left work in an ambulance to the PMH. When they did ECG and all of the tests they run, you don't have no heart problem or anything like that. You're physically fit. The problem was I was having a panic attack because I was wondering how I can get through my school work. I was just elected student government president at the College of the Bahamas of the COBAS then. And I was like, how am I going to do all of this? And I cannot get full-time study leave. And that was an episode I would never want to replay again. Panic attack symptoms. Your panic disorder, your heart palpitation, like I stated when I was on the Defense Force and study leave didn't come down in time. Heart palpitation, accelerated heart rate, sweating, trembling or shaking, shortness of breath, feelings of impending doom. Oh gosh, I'm just gonna lose my mortgage. I'm gonna lose this house. Feelings of being out of control. And the thing is about feeling of being in control with anxiety. When you see folks having anxiety or a panic attack as such, there's, human beings always want to have a sense of control. And what in my research and everything, what I realize is that, and I don't know about you, Dr. King, people in the lower economic echelon, if they have this disorder to a great degree, or you'll find people who are well off, who always want to have control over their situation, having these kind of attack, feelings of being out of control. What has been your experience?
So, you know that there are certain factors, and you're going to talk about some of the risk factors later on, but there are some factors that increases the likelihood of persons developing anxiety disorders, specifically panic disorder. So a person's temperament plays an important role. I don't want to, step on your toes, so I can save that till later. But there are definitely factors that increases a person's susceptibility to developing anxiety disorders, but also specific anxiety disorders. Let's get back to what we were talking about a little earlier about cognitive behavioral therapy and looking at the connections of how a person thinks, which leads to how they feel, which leads to their behavior. So you will have persons that will think automatically in the negative. That whole saying, is the glass half full or half empty? And so your way of looking at things definitely plays a role in your susceptibility to developing anxiety disorders.
And last but not least, you might experience some smothering or choking sensation. Panic disorder. And as you see, the panic cycle. Anxiety sensation, catastrophic beliefs about sensation, rapid increase in anxiety sensation, and you have the panic attack. And you worry about another panic attack, and the cycle can go on and on if you don't deal with it. People with panic disorder often worry about when the next attack will happen and actively try to prevent future attacks by avoiding places, situations, or behaviors they associate with panic attack, They worry about panic attacks, and their efforts spent trying to avoid attacks cause significant problems in various areas of the person's life, including agoraphobia. And we'll explain what agoraphobia is. But what I've experienced in my short time with this subject matter and with working with my client population, sometimes I've noticed that they would try to get busy, but unfortunately, the busyness still don't deal with the anxiety or the worry that is associated with the anxiety. Phobias. A phobia is an intense fear of or aversion to specific objects or situations. And let me say this. Not everything that you might be afraid of is a phobia. You know, you might see a black cat running across the road, you're just scared of cats. And that doesn't necessarily mean you have a phobia of cats. Although it can be realistic to being anxious in some circumstances, the fear people with phobia feel is out of proportion to the actual danger caused by the situation or the object. And, you know, it reminded me of the story of in the Bible, when Moses sent out the spies to view the land which the children of Israel was supposed to enter into. And, you know, as I was reading this as such, I realized that, you know, all of those military guys, all of those spies who were there, they were very, you know, they developed anxiety, they developed a phobia because they saw the people living in the land who were giants as giants, and they saw themselves as mere grasshoppers, and they felt as though the giants saw them as mere grasshoppers, even though they were promised the same land. And so they had a serious phobia that, you know what, if I'm going to cross over this land, these people who are look stronger and larger than me, they could overwhelm me. And mind you, they were trained military personnel. So if you were trained military personnel, you know, the danger that they faced, actual danger, wasn't, you know, as great as they purported to be.
And
go on.
Sorry, you can actually go to the next slide.
Okay.
I'm just gonna kind of look at the connection, because when we're born, we tend not to have phobias. We tend to explore the world without fear or worry or even anxiety. So when we're talking about phobias, it is through, again, and I can come from the perspective of the behavioral aspect of making connections to these particular items or stimuli that leads us to the fear. For example, growing up, you know, we're playing outside and so forth, and you may come across, I don't know, in this day and age, I'll say a snake, because everyone's afraid of snakes, right? I'll just say a snake. So a snake comes up, next thing you know, the snake bites you. You have now connected that snake with hurt, which is then linked with the anxiety of being hurt again if you see another snake. So it's that learning component of the phobias that exist within the world. So you will have someone engaging, for example, in their daily life and just managing. Something happens, that something is then connected to the negative thing that happens to them. And they develop this behavioral response to it where they are anxious, where they're fearful. And so dealing with persons that have phobias, or just even if you have a phobia, is recognizing that that link that has been developed between that stimuli or that whatever that fear is, that fear item connected to the hurt or the anxiety or whatever it may have been that you then develop through that experience.
People with phobias, they may have irrational or excessive worry about encountering feared object or situation. Take active steps to avoid the feared object or situation, and even if that situation really don't pose a real live danger, but in their mind, it poses a real danger to them. Experience immediate intense anxiety upon encountering the feared object or situation. They endure unavoidable objects and situations with intense anxiety. I have a friend, if I ask for a ride and if they have to come pick me up and they have to pass a police checkpoint, they have a serious phobia. They would actually literally turn back round. At least I say, I haven't diagnosed them with phobia, but it appears that they have a phobia. They will turn actually back round because the police would have stopped them, just asked them, driver's license, where you going, as such as that. Would you consider that a phobia, or what would you consider that, Dr. King?
Yeah, I don't want to be diagnosing your
Yes.
friends. But you make a good point in relation to the maintaining the phobia. That persons that have phobias avoid. And
Yeah.
they avoid because they don't want to feel the anxiety that is related to the phobia. So we find ourselves avoiding situations that lead to the anxiety feeling. For example, like if I don't like driving,
Yeah.
I am fearful behind getting behind the wheel of a car or vehicle. I will then do everything possible not to be behind a wheel of a car, and I will take the bus, I will walk, because I don't want to feel the anxiety that is related to engaging in the thing that I am fearful about or anxious about. And that maintains the phobic reaction. And when we're talking about treatment of persons with phobia, it's helping them to not engage in the avoidance or the escaping of the phobic situation, so that they are then relearning how to deal with these particular situations in managing the anxiety, or understanding that those situations may not actually be as bad as they think that it is. So it's recognizing that if you are having a phobia, or you know someone, that there's this constant cycle that exists within avoidance of dealing with the phobia, and treatment helps to break that cycle so that that individual learns healthier ways of dealing with situations that bring about the anxiety.
Specific phobias, sometimes called simple phobias, have an intense fear of feeling of anxiety about specific types of objects or situations. Some examples of specific phobias: flying, heights, specific animals such as spiders, dogs, or snakes, receiving injections. That's me right there. I do not like taking injections. I went to the clinic. I remember taking my son to do his vaccination. And I said, honey, can you stay inside here with TJ while he gets his needle? Because I can stand seeing him get an injection. And because I hate getting an injection, if I have to take a blood test, it takes them at least 5 to 10 minutes for them to put the needle inside my arm, because I'm screaming. I'm literally screaming before the needle even touches my arm. You know.
I just want to let you know, you have a mental health professional over here who could help. So, the next time,
Yes.
we can discuss that later on. But,
Yes.
it is, I think, a lot of the ones that are on the slide, the flying, the heights, animals, these are common phobias that people have.
Right.
I personally don't like needles, but the difference, between someone that has a phobic reaction to someone like me who just doesn't like needles is that I'll do it because I know that I have to, whereas someone will completely avoid, or they will have extreme reaction to needles, whether animals or flights, all of those things. So yeah, you might be, these are unpleasant things, but to recognize that, don't diagnose yourself with a phobia, that these are, not pleasant experiences for some people. But if you are doing the extreme, or it is impacting your life where you are never going to the doctor to go and get blood tests on an annual, or any kind of thing related to injections or any aspect, is recognizing that this is different from your normal daily experience to something that goes into the clinical aspect in a phobia kind of diagnosis.
You want to take that
question? So are you saying that phobia is a form of anxiety?
Yes, it is in the anxiety category. Those are the disorders we're talking about. Troy had mentioned generalized anxiety disorder, which is anxiety about a wide range of things, no specific thing. But with phobias, there is a identified specific thing for that individual that is causing that level of anxiety.
Okay, thank you.
Are you not diagnosing yourself like Troy?
We have a tendency as human beings, we'll go on Google, we go different places, we'll ask our friends about their experience, and then we come back and say, you know what, I have a disorder, self-diagnose, and that is not good. And then we end up self-medicating.
Because I want to bring it back to say that anxiety is a normal emotion.
Right.
That what we're talking about is when these experiences go to the extreme or severe range, that it is impacting the individual's ability to function. I think, at least for me, I get anxious when I have to go and have a needle. There are certain animals I don't like, frogs, for example. So there are certain things that adds to our level of anxiety. But when we're talking about disorders, we're talking about this experience of anxiety that goes beyond the normal experience.
Yes.
That is significantly impacting the individual as well as how they navigate through their life, making certain changes to avoid the anxiety-provoking situation. Like Troy never going to the doctor because he doesn't like needles.
Mm-hmm. Blood. Some people just don't like blood, which is different than they're going to avoid blood situations at all costs, at any cost. Social anxiety disorder, previously called social phobia. General intense or fear of anxiety towards social or performance situations. And that can be if you have to speak to a group, or just like how we have Zoom presentations, you have persons who would have a serious problem actually delivering. They'll prepare for something like this, but when it comes time to deliver, they back away. Worry that actions or behaviors associated with their anxiety will be negatively evaluated by others, leading them to feel embarrassed. So with social anxiety disorder or social phobia, people will not, or individuals will not do certain things. They will not speak in the public, or they will not give their views or opinions on any matter because they don't want to be looked at or become embarrassed because they might have asked what some might consider a silly question, or be embarrassed, or you didn't know that? Where you've been living, stuff like that. They want to avoid embarrassment at all costs. It can manifest in a range of situations such as within the workplace, school, environment. And you got to be very careful of that, especially if you want to matriculate on your job, or if you're going out there seeking new form of employment, or even in your schoolwork, on your educational environment where you have to make presentations. And here, you're an individual, you're a guidance counselor, and you've been off to school, you did all of the studies that you needed to do, but apparently what happened was that you feel as though if I give this information, this might be incorrect, this might not be the right theory used as such, and be those kind of situations. Good. Agoraphobia, and deals with people with agoraphobia have intense fear of two or more of the following: using public transportation. And when we talk about using public transportation, people with agoraphobia, what happens is that these type of phobias, if you're in a situation and you feel as though you might, if you get into a situation, can't get easy escape out of the environment, that's when the phobia kicks in. It is not necessarily just using public transportation, but if you're on a bus and you feel as though you can't easily escape if something happens. Being in open spaces, being in enclosed spaces, standing in line or being in a crowd. And these folks just don't like crowds. They don't like these type of situations where it's going to leave them feeling embarrassed or they can't get out of the situations. Being outside of the home alone. And persons with agoraphobia, they will avoid as much as possible going out in the public. They stay home. They don't go to family events. They don't go to any type of social events. They prefer being home instead of going outside. And if they're going outside, they gotta go outside with somebody else.
There's a hand raised.
Go ahead.
You have to mute.
Where's the hand raise?
Hi, Joy. It's me. It's Jenna. How are you?
Yes, welcome, Jenna. I was wondering, where were you?
I was here. I've been here.
Okay.
I have a question though. I would have encountered a young lady who has been struggling with anxiety, and I'm not entirely sure if you can give me some information about this, but her primary concern is sometimes she feels like she's losing her mind, and that has provoked an intense fear within her that she's going to develop like a mental illness as a result of the anxiety, but not necessarily having been diagnosed with an anxiety disorder.
Right.
I'm not sure if that's being explained clearly, but that intense fear within itself, what exactly could you say to that, or to say to her with steps to potentially manage that, or to help her work through something like that? Because there's never been an actual diagnosis that has occurred. It's just the fear of it has presented some challenges.
So,
go on.
you want me to get, okay.
Yeah, I want to, because I know you were going into that when we move into the other set of slides.
Yeah, the coping.
Oh,
So,
okay. Well, we could wait until you move on then. Don't want to
no, but I'll answer. One, it's important to do a full assessment to really understand exactly the person's anxiety experience. Even though that person may not have been presently diagnosed with an anxiety disorder, does not mean that it doesn't exist. So I would want to suggest having that person talk to a mental health professional to really do a full assessment to understand the ins and outs of that anxiety experience for that individual, to really put them in a particular, I guess, category of where they may be in their anxiety. And there's also some coping mechanisms that we can talk about. But once that assessment is done, we can then look at specific treatments depending on what the issues are presented by that person. I believe in having individualized treatment plans for people, because each of us bring our own issues, whether past or present, to the table in dealing with any kind of mental health issues. So having that assessment done and then looking at the components of that client individual needs and how does that play into helping them deal with the anxiety itself. You can speak to Troy for any kind of referrals, but that would be my recommendation, because the tools that we are going to talk about today are more general tools. So you can share those tools with the individual, but definitely have them link up with someone so that they can explore the specific needs that the client has, and helping her understand the anxiety presentation that she has as well.
Great, thank you.
No, I don't want to go there.
You were kind of done with agoraphobia. You were moving on to separation.
Okay. Separation anxiety disorder. It is often thought as something that only children deal with, but actually, adults actually deal with separation from others. And I'm going to self-diagnose myself again, Dr. King. I think I have a serious disorder because I'm separated from my family. COVID-19 has had them in Grand Bahama for the last month. and I'm locked down here. I have to cook all these meals, and people saying, "Why I'm cooking all this food?" And sometimes I have to end up cooking for 2 or 3 days. Yeah.
Feel less emotional eating.
Okay. Good. Adults can also be diagnosed with separation anxiety disorder. What happened? Have fears about being parted from people whom they are attached. And you'll find, especially with parents and young children, this happens a lot. Mothers in particular, more or less than fathers, in any type of circumstances, especially circumstances, times like this, mothers want to be with their children. Fear leads them to avoid being separated from their attachment figures and to avoid being alone. May have nightmares of being separated from attachment figures. They could have nightmares of, and then certain dreams, and they'll come back. I dreamed this thing last night. I hope something doesn't happen to my child. And, there's a whole gamut of things that goes on with separation anxiety disorder with adults. Risk factors. You want to take it from here?
I mean, we can share.
Okay.
I believe in sharing.
Okay.
So I don't know if some of you remembered the biopsychosocial model that we talked about when we were addressing mental health, mental illness, and specifically depression. And recognizing that with mental illnesses, there are genetic factors that play a role, or biological factors. So individuals that may have family members who have been diagnosed with anxiety disorders are more likely to develop them. But there's also neurotransmitters or chemicals in the body that helps us function. So that sometimes will cause some issues within your anxiety and being able to manage it because of the imbalance of these chemicals. You have environmental factors that also play a role. Currently, we find ourselves in the COVID-19 situation, which then also affects how we deal with anxiety and even our experience of anxiety. Before COVID-19 began, we were kind of happy-go-lucky, at least most of us, happy-go-lucky, going to work, going to school, going to the gym, being able to shop when we want to shop, how we want to shop, etc. But that has changed. And so because of COVID-19, our environment has changed, which affects our ability, our experience of emotions and our ability to deal with them. Not being able to see our family members or having to socially isolate, socially distance. Some people find themselves social isolating, which leads to also problematic issues. Then you have the temperamental traits that a person will develop from childhood and bring into adulthood. And if you are not able to deal with certain situations, you might find yourself experiencing anxiety to a higher level than a person that's able to deal with it in a better way. Exposure to stressful and negative life experiences also will increase your risk. A history of mental illnesses in biological relatives, but also within yourself. So some persons that have mental illnesses are also at risk of developing other illnesses like anxiety disorders. Then you have physical health conditions, thyroid issues, heart issues, utilizing caffeine. I don't know if some of you love coffee like I do, but caffeine can also lead to the heightened experience of anxiety and sometimes brings it on. So there are certain caffeine, medications, substances that can also increase the experience of your anxiety. Physical health or just examinations is extremely important. I promote health. Physical as well as mental health. I always tell people, make sure get your annuals. If something is not feeling right, make sure that you go to the professional you need to go to, especially if you're talking about your mental health. If you find yourself having these anxiety symptoms over a long period of time or a significant period of time, not being able to function, dealing with issues with your thought processing, your thinking, just overall experiences in a negative way, please make sure that you go and get checked and evaluated, because some of the physical health issues can also mimic mental health issues and vice versa, because you can't separate the mind from the body. They are interconnected. So again, make sure that you get your examination. If you feel you're not, your physical health is not right, or your mental health is not right, please go and seek the possible evaluation so that you can deal with any of the issues that you may be experiencing.
Was there a question? Trace, you have a question?
Yeah, hi. Okay. Let's say you are experiencing these, I guess, symptoms, I suppose, and you feel that you definitely need some help. Who am I going to be calling? Am I calling, making an appointment to see a psychiatrist? Am I making an appointment to see a psychologist? Who am I going to?
So both can help. Let me distinguish between the two. So a psychiatrist is a medical doctor that is trained in psychiatry. So they are the ones usually prescribing the medication. A psychologist is not a medical doctor. They are trained in psychological theories and techniques, and they typically will be doing like psychological evaluations, psychotherapy, etc. So the research notes that the combination of medication as well as therapy is the best effective treatment for anxiety disorders and a good portion of mental health illnesses. Now, who you go to first, that is up to you. Because there may be persons who present themselves to a psychologist, and because of the severity of the issue, they might refer you to a psychiatrist for medication review. And there's some persons that will go to a psychologist and may not need medication intervention. So there are a lot of different factors.
Okay.
I believe, because I'm a psychologist, that there is only so much that medication can do addressing the biological component, because if we are focusing on the model of the biopsychosocial model, that there are the three factors that play a role in mental illness, which is your biological, your psychological, and your social and environmental factors. So even though you may be going and getting medication, you might not be addressing the psychological component of that illness. And that is where the psychologist will come into play. So in my experience, I've worked with persons, I've worked alongside psychiatrists, and I've also worked with persons who are seeing a psychologist and a psychiatrist at the same time. So we work in tangent with each other. I've come in contact with individuals that have been on medication for years and have not really seen any kind of positive change within their experience of the anxiety itself. And so that is where the medication has reached its point of the biological factor aspect. And then they engage in psychotherapy and they realize, oh, okay, my thought processes is playing a role in this, or how I perceive my life, or how I deal with the anxiety coping wise. And so I always say it depends on what is available to you, because there are some instances where a psychiatrist may be readily available or a psychologist may be readily available, but either which way, we work in tangent with each other. So if I come in contact with someone who I recognize after an assessment that maybe medication will be helpful in the initial component or the initial treatment of this individual, I'll have the conversation with them. And if I'm working within the public sector, usually we find ourselves in the same vicinity. And I will say to my colleague, hey, this is someone I feel that might benefit from medication. Can you please, assess them and determine if this is a possible intervention that will be helpful for them, and vice versa. So I'm a proponent for both. It just depends on the factors related to the anxiety and the individual needs.
So in this era of COVID-19, the coronavirus, and you hear so much about comorbidity now. A lot of persons who never knew what comorbidity was, but you're hearing so much about it now. I, for one, as a practitioner, believe in medicated assisted treatment, especially for those, and in many instances for those who have comorbidity or have other underlying issues other than the behavioral issues? Let me move on.
Oh, yeah, I covered everything.
Yes, you
Okay.
did. Anxiety and COVID-19. In normal
Thank you for
times,
covering that.
Did you have another question?
No, just thank you. Clarity, thanks.
You're welcome.
in normal times, 1 in 5 American adults deal with mental health issues. And as Dr. Tracy would have explained earlier, that mental health is not mental illness. And what you want to share with for our audience again, because a lot of times when we talk about mental health, people have a tendency to think, oh, we're going to be talking about mental illnesses.
So mental health is something that we all have, meaning our ability to successfully deal with whatever life puts before us, our overall well-being, emotionally, psychologically. But sometimes we find ourselves not being able to deal with certain things. It may be the fact of biological factors, psychological factors, even environmental factors that leads to us not being able to function or have an experience such as depression or anxiety or other issues that leads to an illness, meaning that it is significantly impacting our ability to function in our daily life, whether at home, school, or work. There are over 200 different mental illnesses, and so the different symptoms of them will vary, and the presentation of those symptoms also will vary from person to person. Last week we talked about depression and grief, and those symptoms are typically different than what you will see in anxiety-related illnesses. But yet again, these particular emotions are something that we will all experience. But the difference between the mental illness aspect is that they are experienced at a significant level, impacting your daily functioning in work, home, or school. So you will notice, you know, when all of this started, of course, we're anxious about COVID-19 because it was the uncertainty. And with humans, and you know, we like certainty, we like predictability, we like to know that, you know, I have to go to work in the morning, I need to do this, I need to do that. What are the things that I need to do to protect myself from getting COVID-19? But because there were so many unknowns, there was a lot of anxiety centered around that. And to recognize that that is a normal reaction. But when you are then experiencing this anxiety 24/7, not being able to eat, not being able to sleep, not being able to think or concentrate, and other symptoms, then you shift from this normal experience to something that can be then considered a mental illness.
But anxiety is one of the most common mental disorders. And like Dr. Tracy said, I believe 80% of us would, or not 80, almost 100% of us would have experienced some form of anxiety in our lifetime. And as we stated before, you know, that's the normal type of anxiety, not where it becomes overwhelmed and end up into a mental disorder. 6.8 million people in the US, 3% of the adult population suffer from generalized anxiety disorder. Anxiety increases in response to COVID-19, and you can figure out after we had gone through what anxiety is all about, the panic disorder, and all those things, you would understand why anxiety would increase during this pandemic. You know, because people are, like I said, concerned how they gonna meet their commitments at the end of the month, how they're gonna put food on the table for their children, how they are, what their life is gonna be like tomorrow, next week, next month, if anything is gonna come back to normalcy to them. Too much anxiety can start to cause harm, and that's when it becomes really overwhelmed. That's when anxiety starts to cause harm. Dr. King, can you share with us how the closeness and the similarity of anxiety and depression, how in many instances they work hand in hand?
So you mentioned comorbidity of mental illnesses. So basically what that means is that an individual will have two mental illnesses at the same time. And there is research out there that notes that a person with a mental illness has more susceptibility to developing other mental illnesses. There is also relationships between specific illnesses. So you have anxiety and depression having high relationship with each other, but also substance use, which you will be talking about next week. So you will notice that persons with these particular illnesses may experience other illnesses. Sometimes they will develop the illness because of coping mechanisms when in relation to substance use. Persons that are depressed or anxious sometimes will cope through utilizing substance use and then eventually develop a substance use disorder. So at this day and age, we will see sometimes individuals sometimes presenting themselves with depressive symptoms, but also anxiety symptoms. And looking at the assessment component of these illnesses, you will see some commonality between the two, and recognizing that there's also not only commonality, but some differences. And with treatment is looking at the commonality aspect and treating those underlining similar issues, but also addressing the issues that are unique to whether the depressive symptomology or the anxiety symptomology. And that is where I talk about individualized treatments, because what may be leading the individual to present with both depression and anxiety differs from person to person. So the assessment component of treatment is really important to really understand what is the unique factors that the individual is presenting with, so that the treatment can be geared towards those particular factors. So not everyone who has depressive and anxiety symptoms are going to be the same. So there is no one treatment fits all across the board, but there is definitely the research out there that talks about that a person with mental illness will have the susceptibility of developing other illnesses, and you will sometimes see individuals presenting with multiple disorders in this day and age.
Yes, and during this pandemic, this is an anxiety-provoking and stressful time for everyone. So there will be days where we will experience some level of anxiety for whatever reason. Anxiety and COVID-19. You can summarize it from here.
Okay. So again, I want to highlight that anxiety is a normal emotion. We talked about different disorders in relation to this presentation, but there are more disorders out there. But because of time factor, we are just going to keep it to the generalized anxiety, the specific phobias,
Hi.
separation
1 minute, Doc.
anxiety.
Can everybody just mute their mic, please?
I think it's just one. You see it?
Okay, that makes sense.
All right.
Go on.
So looking at those particular anxiety disorders, but again, the commonality between them is this experience of anxiety that is a higher experience than you will typically have. So please don't self-diagnose, because I know we are tempted to do that all the time. In grad school, I find myself doing that as we were learning different mental illnesses. I was like, well, I have that symptom and that symptom. Does that mean I have that diagnosis? Don't do that, because that sometimes also feeds into the worst case scenario when you find yourself identifying this symptom, that symptom, and so forth. But if you do recognize that you are experiencing these symptoms, go to a mental health professional. They are the ones that are qualified to provide a level of diagnostic understanding so that you can for sure be diagnosed with whatever the issue may be. And it might just be the fact that you're experiencing some life issues. Not every mental health issue is an illness.
Right.
You want to chime in?
Yeah, and what we, I want to just add to what you said about self-diagnosis. What happens is that when we self-diagnose, we can actually end up living out our diagnosis and did not even have any illness or disorder, and eventually develop that disorder because we self-diagnose ourselves and we say, okay, then I have this. I saw this online. This is what the book said. And they start playing it out. And eventually it becomes what they diagnose. And when they go for help, they find out that they have it and not necessarily had it from the initial diagnosis of self-diagnosing. Yeah.
So at the end of the day, if you are experiencing any of these symptoms, please reach out and get the help that is needed. So, coping strategies. As we started this series, we talked about developing tools and giving you tools that you can add to your toolbox, because some tools are better to be used in certain situations than others. One of the things that I found helpful, and a colleague in a Caribbean country shared this with me, I feel like a month and a half ago. I can't really say where it originated from, but it is interesting, and it is a question that we need to ask ourselves. Who do we choose to be during the COVID-19 crisis? When this began, we thought this would be over overnight. However, this is what they say, this is not a sprint, this is a marathon. So then we question ourselves, how do we deal with this COVID-19 situation that it may even be around with some of the reports, which is kind of daunting, till next year, some of the aspects of this particular COVID-19. But what do you find yourself, who do you want to be? Do you want to be someone who is anxious all the time, always on edge, or do you want to look at it as the glass is half full? I prefer the glass is half full because it provides a level of peace and calm within this storm that I find myself in. But looking at the spectrum, you have the fear and anger zone, where you find yourself panicking, finding yourself being irritated. Then you have the learning zone, recognizing, hey, I can start to let go of control and recognizing there are some things that I can and cannot control, that I can make a plan to use my time in a better way. So this is heading more into the positive way of thinking and dealing with it. And then you have the growth zone, a sense of finding a meaning in what to do in every day, constantly seeking out ways to help others, being in the now, being grateful, hey, that you woke up this morning, even though you have to be in your house on lockdown. So ask yourself at the end of the day, who do you choose to be in this situation? Next slide. And again, coming back to what do you have control over? Anxiety is always, is typically based on level of control. Mm-hmm. And that thought of, I can control this or I can't control that. And part of dealing with the anxiety is recognizing what you have control over and letting go of what you don't have control over. We don't have control over when COVID-19 is going to be over. We have no idea when this is going to happen, but you do have control over how you deal with the situation. So you have control to choose to have a positive attitude. You have control to turn off all of that negative news. You have control over finding fun things to do at home. You have control over those things. You do not have control over if other people follow social distancing. You don't have control over actions of other people. You are in an environment where you're surrounded by people. Sometimes the people are nice to be around, but 24/7, it can be stressful. So you have control over how you deal with that. You do not have control over the person, but you have control of how you deal with that individual or deal with that environment.
And you know, I like to share with persons when they tell me the level of control they have over a certain instance or action or situation. And I ask them the percentage amount of control they have, and they tell me, for example, I have 80% control over this situation, and I ask them, okay, are you doing everything in your ability? Are you doing everything with that control? Are you doing everything you possibly can with that? And they answer me yes. Then I would say, so why are you worrying? And I don't ask them to answer me. I just ask the question for them to think about it. And also I share with individuals the serenity prayer, and that's an awesome prayer because it's a universal prayer that, God grant me the serenity to accept the things I cannot change, the courage to change the things I can, and the wisdom to know the difference, and just rely on that and just let it go.
So I like to give people options because you might be tired of doing one coping mechanism versus the other coping mechanism, or some of the coping mechanisms may not work for you as an individual. So I give options. One, listening to soothing music can bring the body down to a level of calm. So please, which is opposite of the depression. Usually persons that are in depression, I tell them find some upbeat music, like my mommy like to call it jumpa music. But something that is upbeat, that kind of gets you in a good mood. However, with anxiety, you don't want to be kind of elevated. You want to bring yourself down because you're already elevated. So find some soothing music. It may mean spa music. It may mean instrumental music. But whatever that music is that brings a level of calm to you, utilize that. It might also be good to journal. Journaling allows.
Before you go on the journal, just on music, try not to listen to victim music. When I say victim music, music to make you feel sorry for yourself and stuff like that.
Yes, because that could go and trigger depression.
Yes.
So anxiety, remember, calming music, not victim music. That's what you called it?
Yes.
Victim. Okay, so no sad, depressive music. We don't want you to get depressed by the music. But make sure that the music provides a level of calm for you. Soothing music. I usually have some meditation music on my phone. Is an example of the type of music that could be helpful during anxiety related issues. Journaling is always good, whether you're anxious, but just journaling in general is helpful because it allows you to, one, process how you're feeling, helping you to identify your feelings, but also get them out on a paper if you don't have someone that you trust to be able to share it with. Again, coming back to the physical health, making sure that you eat a balanced diet. I'm not saying just eat carrots and salad all day, so you can, splurge a little bit, but make sure that you get the nutrients that the body needs, because a good balanced diet is not only good for your physical health, but it's also good for your mental health. Sleep is also one of the important aspects that is good for your physical and mental health. Exercise. Persons that are anxious have all this energy. So I tell people, exercise, get that energy out. By exercising, it also releases the tension that anxiety tends to build up in the muscles itself. So make sure that you exercise, and that exercise could be whatever you choose it to be. I don't say go and run a 12-mile kind of race, or to, challenge yourself to, lift 100, 100 sit-ups, push-ups, but just do a level of exercise that you feel comfortable getting your body energized and engaged, and be able to utilize your muscles to release some of that tension. Exercising also means stretching. So that whole yoga thing that I have right there in that picture, recognizing that stretching is also a good thing. And yoga is also known to be calming to the mind, as well as allowing the body to stretch some of that tension out. Cut down on caffeine. I say that
to yourself too.
But yes, cut down on that caffeine. For someone who loves my caffeine, it is difficult at times, but recognizing that caffeine also plays a role in how you experience anxiety. Oh,
sorry.
That's okay. There is this thing called coloring. Yes, adults do color still, but coloring as a level of a term called grounding. It means getting out of your head. So coloring allows you not to be focused on your thoughts that can be driving your anxiety, but allows you to focus on something that can be fun and creative. So try coloring. You might have some colorful crayons, or they even have color books for children as well as adults. Definitely cut down on the alcohol, but in the Bahamas, I'm quite sure that's not an issue for us, because the
Wait.
all on lockdown. So no access to any alcohol unless you still have some in your house. But definitely cut down on the alcohol and substance use because it doesn't help. I know a lot of people say, oh, it does, it calms me down, but in actuality, it does the opposite. Take a bath. Again, a part of the grounding mechanism, getting yourself out of your head and being able to be in the now. Taking a bath can also be relaxing. Sometimes getting some of that hot water on you or being able to soak in a club with a tub with bubbles just to kind of calm your mind can also be good. Calling a friend because, hey, you're anxious and you're worrying. Maybe calling a friend takes you out of your anxiety provoking mindset. And even calling a friend can help be a sense of comfort, helping them to see where you're coming from, but also let them be a voice of reason in your anxiety state. Accept that you have anxiety. There's nothing wrong with being anxious. Remember that in this situation, that anxiety is something that we will experience. It is a normal reaction. So don't be too hard on yourself when you experience these feelings. Build a support network. Knowing that in this day and age, because we have to socially distance ourselves, that it's important not to get in the point of social isolation. So developing a network that is supportive for you, with you, but also recognizing that you may have friends that are anxious persons, to also be a support network for them as well. Recognizing what your triggers are. A trigger may be having to be on a weekend lockdown and sitting and like wondering, like, what am I going to do for the next 2 days and having to stay in my house. Also taking a break from technology is also a good way, because technology, you know, we have all of these news out there as well. You can go on to the next slide.
And what I want to say too about learning about your trigger points, and it's key. It's key to learn what your trigger points are, because that can cause you to have some form of relapsing, especially persons who, and I don't want to dive into substance use, like, because it's next week, persons who take substance or even medication, and they're addicted to certain form of medication. Once you learn, you know how to avoid those things. And then when you mention about exercise, get regular exercise. When we exercise, there are chemicals that are released in our brains, and I like to call them good feeling chemicals, and that can help clear up your mind so that you can actually try mindful coloring, and you can actually do things that is positive, that is energetic, and that can be productive for you as somebody who's going through an anxious state. Yeah.
I just given all y'all these tools today.
Yes.
Make sure focus on the things you can control. Again, coming back to the cognitive behavioral aspect, that our thoughts are typically driving our feelings, which leads to our behaviors. So recognizing that, there are some things you can't control, and looking at the glass as half full, even though you may be tempted to see it as half empty. Control how often you engage in keeping update. You do not want to be watching the news 24/7. Being engrossed in that kind of information can also drive the anxiety. Keep the big picture in mind, recognizing, they always say stay at home, save lives. That staying home is saving lives, not only for yourself, but the people around you. Be able to model peaceful behavior, because we are living with persons, including children, and children will model what they see. So we have to remain for ourselves peaceful as well as calm. Evaluate yourself. Recognize what you need in that particular day. Allow wisdom and logic to guide you. Sometimes our thoughts are irrational. As they call it, the worst case scenario train. We find ourselves writing all the time, which just drives the anxiety. Recognizing that if you're feeling isolated, to maintain a level of connection, whether digitally, technology-wise, because there are so many options at this day and age. I have family and friends all over the world. And one of my two close friends, we are scheduling a girls' party kind of get together tomorrow, like a Sunday brunch. So we can stay connected in the COVID-19 situation. So again, make sure that you don't isolate, but that you socially distance. Also, be careful of the news that you get exposed to, because there are a lot of, I don't want to use fake news, but there are a lot of news out there that isn't really real, that plays into anxiety-provoking issues and leads you to being more anxious in the situation.
And it's good to share different strategies and coping mechanism, because as you were saying, there's so much news out there and everybody becomes an expert with COVID-19. And so what something might work for someone, A, not necessarily would work for B. And so you got to be very careful in the information that you take and how you utilize that information.
This is my last coping slide. Yes, it is.
Yes.
Okay. Wonderful.
It's looking like a girly coping strategy, yeah.
Well, got to put that in there.
I know, right?
So those are typical ones that you can use. But what I added is a 5-minute self-care, because even though you may be anxious, those are coping mechanisms. Let's not forget self-care. Self-care is super important. So you may not be the person experiencing the anxiety, but those techniques are still good because they're all a part of self-care. Other things that can be helpful and very quick is taking some deep breaths. Breathing is important, not only to live, but also to calm. So we do this relaxation, deep breathing, where I will tell people to just inhale, counting 1, 2, 3, 4, inhaling, and exhaling, counting down 1, 2, 3, 4. By slowing down your breath, it means that it helps the body to slow it down, and therefore decreasing your level of anxiety in the midst of everything. Drinking a glass of cold water also is part of a grounding technique. It takes you out of the thinking and into the here and now. Stretching is also good. You don't have to do these very hard expert yoga poses, but just standing up and just stretching your arms above your head, leaning yourself over and stretching your back, laying down and just moving one leg to the other side. Just various simple stretching can help you get your mind out of where it is and lead to a level of relaxation within the muscles as well as a calming effect. Spend some time organizing. Yet again, it's a grounding technique to get yourself out of your mind and focusing on the here and now. The grateful aspect of writing down grateful things is shifting that pessimistic mindset into something positive. So what are you grateful for today? Are you grateful for that it's sunny? Were you grateful that it was raining yesterday? Are you grateful that you can sit down and watch 10 hours of Netflix, which I don't agree with, but the fact that you have internet and can have access to something that is enjoyable, and say positive affirmations out loud. I can handle this, I got this. There is a Caribbean song that I shared today that was shared with me about different Caribbean artists talking about we got this, even though we're in the midst of the COVID-19, that we have a level of resilience, that we can navigate through this situation, that we can handle whatever we are faced with. And so saying that with to yourself increases your belief that you can navigate through your anxiety, that you can deal with the COVID-19 situation and help others do so.
What I want to add to what has helped me, and I think coming from the military background, what I started to practice is every morning I get up out of bed after my devotional, I make up my bed. And by making up my bed and make sure the room is straightened out and making sure my favorite place, unlike you, I think, is the bathroom and the kitchen, the two areas I like cleaning. And so I make sure I clean the bathroom. My bathroom cleans every day. Every morning I clean my bathroom and my bedroom. And so it helps a great deal with self-care, because when I put things in an organizational perspective, I am able to take the clutter out of my mind and actually become productive throughout my day.
So yet again, you can go to the next. These are some local resources that we have been sharing. So feel free to write them down, take a photo of them. But these are the local resources that we currently know of. If you have any resources you would like to share, please send an email to Troy, or you can even send it in the chat. But this is what we know for now. And we will now open the floor to any comments, questions. Oh, you can go back to that.
Okay.
We'll leave it up there
Okay.
while we answer questions. And then
can you share
we'll
with me what is MHPSS, please?
So MHPSS is an acronym for Mental Health Psychosocial Support. It is the level up from psychological first aid. So it is addressing the immediate needs of individuals' psychological and emotional needs. I think that's the easiest way of me to explain it.
Good. Folks, we now open up for questions, comments, observation, experience. Not all at once.
We got one, we got two.
Okay, go ahead. David, Vanya, David.
Okay, thank you, Dr. King, thank you, Mr. Clarke. I wanted to say Dr. Clarke for having me on this program. It's very interesting, and really, I don't want to miss out on a minute, because every moment of it, every word of it is of importance that you can share. But I want to get back when you spoke about self-diagnose. And just to share a thought, when we were talking about phobia, I often say I have a phobia, and people laugh.
Right.
They say, you think you have a phobia? I say I do have a phobia because I'm somebody, yes, I go to church. Yes, I go into certain forums, but if it is organized where people are sitting, or, you know, like a funeral, a service, a wedding, I do not have a problem. Right. But if I have to go in an open space, for example, like a park where they have some concert or this type of things, I kind of feel very, you know, like that is not the place for me. I should not be there. I feel like I am stifling, although it's an open space. I usually feel like, you know, something is not right. It's like I'm the crowd per se.
Right.
Now, I remember couple years ago, I tried on 2 occasions being around town and passing close to a carnival band. I'm not a carnival person, I've never been. For some reason, I'm not sure why carnival has just not gotten to me.
Which country you're from again?
Dominica.
Okay.
But we have to cross to get to our home.
Right.
And even to cross through, that band is coming. I feel like, you know, it's like I'm actually falling or something is happening to me. And so people said to me, oh, it's because of my home, because of my church, because of my whatever. I said, no, that has nothing to do with it, because I actually feel if I have to pass through that open crowd, it makes me feel like different than I'm accustomed of feeling. So I personally have not gone to anybody or have nobody, no doctor have diagnosed me, but I just feel I have a phobia for that type of open crowd. What do you think of that?
You gotta be careful with self-diagnosing. There are certain situations that we may find ourselves not being comfortable in. But that doesn't mean that it goes from not being comfortable to a straight phobia. So when we're talking about diagnosing a mental illness, I always say, if you feel that something isn't right, go and see a mental health professional, because they are the ones that are trained to really do the assessment to come up with a diagnosis, or even to determine if there's an illness that is present. Because not all mental health issues will equal an illness. It may mean that there are things that you have a difficulty dealing with. And once you are seen by a mental health professional and you understand what is happening internally and then learn how to deal with it, then you will be okay to move on with whatever the situation may mean. So if you find yourself not being comfortable in situations such as that, then don't self-diagnose and automatically assume that you have a mental illness. To go and seek help for that professional to really do a thorough assessment to determine why might you feel that way. It may have nothing to do with a phobic reaction. It may mean that you really just don't like crowds. And maybe you are an introvert and crowds just drain you of your energy. So it may not be a phobic situation. So again, see a mental health professional, let them do the full assessment that is needed to understand what is happening, and then help you to deal with that in a professional way.
Thank you.
You're welcome.
Tracy, you have a question?
Hi, yes.
Go ahead.
So what is your suggestion or your recommendation for a person that you can tell they're spiraling out of control because they're suffering from some kind of anxiety? They of course are in total denial. They don't want to hear anything. How do you get help for those kinds of people who really need help?
So the thing about getting help, it's voluntary, unless you are harm to yourself or harm to someone else, which then leads to inpatient treatment. But at the end of the day, it is the person volunteering themselves to get treatment. As a person who is witnessing an individual that may be experiencing a mental health issue, all you can do is try your best to encourage them to seek help, to be a support system for them, and able to get them the necessary resources. So I've had individuals seek help, not for themselves, but their family members or friends may have brought them to get help. And then they get there and they was like, well, nothing is wrong with me. I'm only here because so-and-so said that I needed to come. So as a person who may know an individual who definitely may be exhibiting some of these signs or symptoms, is to say, hey, I think maybe something is going on with you. Maybe, I can help you try to get some help, or maybe give them some numbers and referrals to say, maybe these persons can help you. But at the end of the day, we can't force anyone to get help. We can't force anyone to engage in treatment. All we can do is to be a support system for them and to encourage them, whether verbally, as well as providing resources for them in order for them to actually, one, seek treatment, or be by them to help them get the treatment. And even in the midst of treatment, be there for them as well.
Also, what I want to add to that, Dr. Tracy, is that when the person is volunteering and seeking help, I want to reiterate the point that you made about the support. It's very important, especially if it's a family member or even a friend, because in substance use disorder area, family isn't necessarily biological. Family can be that extended friends, relatives outside there as such. So it's very important as the individual seeks help and gets help, and while the person is in treatment, you want to get that full support behind them so that they can transition, their matriculation through the program can be successful. And also it'll help you understand their disorder. And by you understanding their disorder, when lapses or relapses come about, you can have an appreciation and see that this is a disease of the brain and is treated just like any other physical ailment as such. Okay, good. Any other questions? Go on, Elvis.
Afternoon, Dr. King, from CLARKE. Very interesting session again today. My question is, for as you said, don't let your fear influence your decision making. So let's say, for example, somebody who would have been laid off from the hotel, and they have been, let's say, for example, a chef in the hotel. Would this be a time now for them to evaluate their situation and perhaps start thinking or looking at what can I do to put myself in a position that I would not end up in this situation again, seeing that I have all these skills that I'm providing for the hotel or whatever other, job they may have been laid off from. But would that be one of the coping strategies to do a self-evaluation and start reading as much information on how they can better position themselves to be productive in life?
Go ahead, Troy.
Most definitely, that example that you would have used, a chef who would have gotten laid off from the hotel, who would have a certain level of skill set, then he or she can look at this crisis as an opportunity and not necessarily a negative thing. Whereas you can say, okay, there's time now for me to actually broaden my skills, broaden my marketing ability in the skill set that I have, start a business, and start delivery services, those kind of things. So it don't necessarily have to be somebody who got laid off as a chef, but in any field, that individual can actually evaluate, like you stated, their current position and use this time to actually enhance their skill set and see the opportunities that are afforded to them out there and actually use this to become self-sufficient. You know, during times like these, a lot of millionaires are created, but it takes a lot of assessment. It takes a lot of looking within oneself, preparation, and then seizing the opportunities that are available to them. So,
I agree. I don't have anything else to add.
any other questions? Or we have, David, you have another question? I guess I never took that hand now. Are there any more questions? I don't see no more hands. I guess you can wrap up, Dr. King.
So again, thank you for joining us on this wonderful Saturday. We are glad to continue this series next week, where we will be focusing on substance use. Troy, again, will be leading, right? And I will just be a little side person because this is your area mainly, right?
Yes.
And so I'll just chime in occasionally with my tidbit. And we look forward to seeing you all back. Feel free to also send questions. I know when you are registered for the series, you were given an email to send questions or comments to, and Troy will be looking out for them. And until next week, be safe and stay healthy. Oh, you have to do the slide.
Yeah, also, if you want to look back and get the information that you need on the slides that we're doing, because we're not sharing the slides, the only way we're sharing the slides, you can go on my Facebook page, Troy Clark Facebook page, and you can get your information from there, because we actually are streaming live via Facebook. And to those persons in Kenya and those persons in North America who are on the Facebook feed, thank you very much for joining us with Let's Talk Mental Health and COVID-19. We were excited to have you, and we will respond to your comments that you have left on Facebook.
Take care, everyone. See you next week, May 9th at 1 p.m. Eastern Standard Time. We will be continuing talking about substance use disorders.
Awesome.
Sign out. Bye.